Hey everyone, today we're going to talk about ITB syndrome, also known as this lateral knee pain that runners typically experience. I'm very passionate about this topic because one, I'm a runner, and two, I treat a lot of runners and I know how frustrating and how debilitating this injury can be. As you know, I'm sure, is that it's very common to experience this. And so when you do experience this, it can be difficult to treat, and if it progresses, then it can start to affect your day-to-day activity, and then you start to have pain, like going downhill, going downstairs, even just getting out of bed. So let's talk about that today. In this first video today, I'm going to talk about what IT band syndrome is, what the causes are, what some risk factors are, and then how you can go about treating it. And then I'm going to dive into some phase 1 exercises that I think everyone who experiences this, or even just if you're a runner looking for more so injury prevention and some prehab exercises, I recommend these for everyone. Okay, so let's talk about the causes of IT band syndrome first. So the obvious one, overtraining. So when we think about overtraining, what does this mean? The obvious answer is an increase in training demands followed by inadequate or lack of proper rest or recovery. Now, an increase in your training demands doesn't necessarily always mean that you're just running increased distance or increased time on your feet, increased mileage at the end of the week. It could also be that one, you're doing more hills. Okay, so hills tend to be a big issue with IT band syndrome and runners who experience knee pain, especially if you're doing a lot of downhills. Okay, so the uphill actually puts significantly less forces on this tissue than the downhill aspect of your training runs. The other aspect that you tend to not think about is speed. Let's say you're trying to get a little bit faster and you're trying to increase your speed. Maybe your body is just hasn't adapted as well to be able to tolerate that speed. Maybe you don't have the hip stability to tolerate it, or the quad control. So increase in speed, increase in training volume, which could mean either distance or just intensity overall, or increase in hills. The other big risk factor that we tend to see this with is if you're doing a lot of trail running. When we think about trails, a lot of trails, especially if they're just built for trail running, are pretty narrow. So you tend to have a very narrow step width, and so your feet are close to each other when you step one foot in front of the other. Now, what that does is it actually causes a little bit more internal rotation and this knee valgus that we tend to see, which is just going to load that tissue a little bit more and potentially aggravate things. Now let's talk about a couple other things that aren't definitely going to mean you're going to have this issue, but they're shown to be related. So weakness in your hips, which as we've talked about before, if your hips are weak or if your knee is caving in, which tends to happen with weak hips. So if this hip is weak, then when you land with this leg, you tend to come inwards a little bit more. You get some more hip adduction. This hip drops, this knee comes in. That can be a risk factor. Also, contralateral hip flexor restrictions. So if you have mobility limitations on this side, you might be more at risk for having knee pain on this side. So it doesn't always have to be the same side to be causing issues. So think about both sides when you're addressing yourself. Another factor that could be playing a role is what's going on at your feet. If you have excessive pronation and you can't control the pronation, that could also be contributing to forces up the kinetic chain, such as at the knee. Excessive pronation, if you have really good control over it, it's not necessarily a bad thing. But if you can't control that pronation, if you don't have the strength and stability at your foot and ankle to support it, if you don't have the hip strength to counteract that, then that's when we start to see these impairments, and that's when we start to see injury. Okay, so what is your IT band? There's all these names for your IT band syndrome. We've heard it as runner's knee, which can sometimes mean IT band syndrome. It could also just mean patellofemoral issues in general. But we've also heard IT band friction syndrome or IT band compression syndrome. From doing some of my own personal digging and research, it seems to me like it's more of a compressive syndrome, and that you get compression on this tissue down here at your knee, and that's when we tend to see injury and pain. So your IT band is actually a really thick band of fascia that extends from your hip all the way to your knee. So you have your TFL and your glutes that basically come down to where this bone is, your greater trochanter. Your IT band is this band of fascia that extends from that area where those muscles are going to insert, and then it comes down the side of your knee into the lateral aspect of the knee and attaches onto your tibia, which is this bone here. That's why it's called iliotibial band. So it attaches all the way down here, and it's meant to be a thick band of tissue. It's meant to be thick. And so that's something where I think people have got in their head, like, okay, I need to release my IT band, I need to do certain things because it's so thick, it's so tight. It's meant to be thick and strong, and it's okay for it to be that way. It's a normal tissue property, just like how you want your tendons to be strong. You don't want them to be all like loosey-goosey, and you want them to be strong and be able to store energy and release energy, just like what the IT band is going to help you do every time you load and explode forward. So your IT band experiences the most forces when you're on this heel strike to mid stance, okay? So if you think about it, sometimes people feel like, okay, it's hard to bring the leg through in this movement because sometimes it feels like your knee is getting pulled out to the side. But really, most of the forces are happening right when your heel hits the ground to this part in the mid stance before your next leg carries over. So essentially, over time, when this gets aggravated, maybe your hips are weak and it throws off your biomechanics, maybe you've done a lot of trail running or just have a narrow step width in general with your running. Over time, what happens is your IT band, where it inserts over by the knee, there's some highly sensitive tissue underneath that, and it gets irritated, it gets compressed over time. And so we want to try to strengthen our hips, alleviate those forces on the knee. Maybe it's correcting the issue at your feet, maybe it's at the hips, maybe it's a mobility thing. I'm going to talk a little bit about all of that in this initial phase where I think every runner could benefit from doing these exercises. All right, so for phase one, you're going to need a yoga mat, grab a weight, and a resistance band. We have 4 primary goals involved in phase one. The first goal is going to be to restore your proximal hip strength. The second goal is to improve your quad strength. The third goal is to restore your foot and ankle control. Maybe it's more of a motor control thing. Maybe you actually have to work on your strength. And the fourth goal is to restore your mobility where you're lacking. There's 3 mobility exercises I want you to start adding in. One of them is more of an assessment, and you'll see why. And then we're going to target 5 different strengthening exercises, and that's all you need to do for phase one. So grab a table or just hang off the edge of your bed. You're going to have a seat right on the edge that you're kind of about to fall off. Hug one knee in towards your chest. Your opposite leg is just going to be hanging down. You're going to let yourself rock back and just let this leg fall down. You want to see where that leg falls. Is it super tight in your hip flexor? Is it super tight in your hip? How does this feel? So you want to check both sides and see how the range looks side to side. You also might notice certain differences, like this knee might be out to the side this way, or you might have more rotation one way or the other way. Just important to note for yourself, and that's more of an individualized program, and so you want to just be mindful of those differences side to side. Okay, now that's the assessment. Now, how are we going to address this as a mobility exercise? What I want you to do is start in the same starting position where you're just laying down, having this good stretch. Relax your head, and then you're going to bring your bottom leg all the way up and then slowly lower it back down. So we're moving through your full available range of motion, your entire range of hip flexion to extension here. Okay? So it's a mobility drill. It's not meant to be super hard. But what you can do, if this feels way too easy for you, is add an ankle weight down here, or strap a weight, kettlebell, whatever, to the bottom of your foot, and then move through that same range of motion, moving all the way down and up. And we're going to be using this as a dynamic mobility exercise. So that's the first exercise I want you to focus on. The second thing I want you to do is what we call the couch stretch. So I have a chair here. You're going to bring one foot up behind you, and then you're going to come into this half kneeling position. You're not going to feel too much of a stretch if you're in this pelvic tilt like this. I want you to do the opposite, where you're kind of tucking your tailbone and really squeezing your glutes and leaning back this way. Keep yourself nice and upright. Don't let yourself come into this position. This isn't stretching what we want. This is what we want. Okay, so again, sit up nice and tall. You're doing a pelvic tilt, drive the pelvis forward a little bit, tuck your tailbone, and you should feel a really good stretch into your quad. Then you can kind of bias it a little bit to one direction by dropping the foot a little bit into one side and doing that same stretch. So this should feel really good. I want you to do this for about 30 seconds. Okay, and obviously both sides. So bring that opposite leg up Even if you only feel it on one side, always stretch both sides. And for me, one side is always a lot tighter, like this one. So for me, I can only go to right about here. Even with the pelvic tilt, I'm not able to sit up quite as straight as the other one, and that's totally fine. It's just tighter on one side. 30 seconds on each side. This is still part of your mobility warm-up. The third exercise that you should be doing, not just as a warm-up, but also just throughout the day, is just stretching this area out. And you may again notice that one side is tighter than the other. Your hips just may be limited on one side versus the other based on what what sports you've done. If you always favor one side, it might just be your posture throughout the day. So very typical to not be perfectly symmetrical. If you do have like a seated job or the ability to sit throughout the day, do a couple of these throughout the day, just a seated figure 4 stretch, nice and easy, and then do this before and after running. Let's dive into the strengthening exercises. One of my favorite exercises is a single leg bridge. And I love single leg bridges because it's activating your entire posterior chain, you're getting your core engaged, but it's also working on hip stability as you make it single leg. So you want to make sure your hips are level throughout this exercise, and you can consistently progress based on what your level is. Go ahead and lay down for your single leg bridge and then raise one leg up. I like to engage my quad on this side. You can just do a single leg raise on this side and then basically squeeze your glutes and think glutes first, lift your hips, then lift your back off the table as high as you can and then lower back down. Lifting up and down. Again, the key here is to make sure your hips are level. So we don't want our hips falling to one side or the other. You don't want that hip drop. So keep your hips level, coming all the way up, pausing at the top, and lowering back down. I recommend doing 2 sets of 20 per side. Once this gets easy, or let's say you're already doing these and you're like, this is too easy for me, you can always add weight, which is something I love about bridges, is you can always increase the challenge. So you can add weight and do a single leg bridge with weight. You can also change the height of where you're bridging from. So prop your legs up on either a bench or a chair and do bridges that way just to come into a little bit more of a range of motion. All right, next exercise I'm actually going to show you with the shoes off so you can see what the feet and ankles are doing. So we're going to do some standing clamshells. I love this one because it targets foot and ankle stability, single leg balance, which as we know, running is all shifting our weight from one leg to the other, and also hip and glute control. What you want to be focusing on here is pressing your big toe down into the ground and trying to not scrunch your toes, but try to press that big toe down to have the force go through it, and then just try to shorten your arch and lift at the arch a little bit so that your arch isn't collapsing downwards. You can see that when you have good control over your arch, your knee is going to be in a better alignment as well. Hips are forward, open, and close. 2 sets of 20 with this exercise as well. On each side, switching sides. Again, think about making sure you're keeping your hips straight, facing forward, opening and closing, and still being very mindful of what's going on at the foot and ankle and at the knee. Exercise number 3, we're going to be doing some lateral walking. Drop the band down to your ankles to make it a little bit more challenging. If that's too tough, keep it at your knees and just think about pushing out against the band, against your knees. So you're going to keep a little bit of a bend in your knee. I try to work in that like 10 to 20 degree of knee flexion with this exercise, because that's really when you experience the most forces at the IT band. Again, it's from heel strike to mid stance, but you have just minimal knee flexion in that position, okay? So I'm adding the same amount of knee flexion that I could be experiencing to my exercise to really match that. So you're gonna still try to maintain your arch and try not to let your arches drop in. So pushing outward slightly against the band, still pushing the big toes down into the ground, and then just doing side steps. So this is a great exercise to continue to work on your control at the foot and ankle joint, but also just working on hip stability. With this one, you can go lateral or monster walks, just coming up and out, okay? Going forward and backward, down and back, down and back. For this, I usually set a timer and go 3 minutes each direction, 2 sets. Exercise number 4, we're we're going to be just doing a seated straight leg raise. So what we're going to be doing here is start here in this upright position, hug one knee in towards the chest, hold on, squeeze your quad, engage this muscle, lift and lower, lift and lower. You may notice one side goes a little bit higher than the other, and that's okay. If you notice this is too difficult, it hurts your knee, or you're not able to maintain that straight leg throughout this whole thing, that quad activation, and it bends as you come up, drop back onto your arms this way and do the exercise here. If that's still too hard, drop down onto your elbows and do it this way, okay? And for this, 2 sets of 20. Keep it the same, keep it easy to remember, 2 sets of 20 on each side. Again, you may notice one side goes higher than the other. For me, my right side is just naturally a little bit easier to lift up, but we work on both sides. And exercise number 5 that I think is super important is going to be starting to load your quad and be doing a split squat and getting into this single leg squat position. With this, you want to be just hinging forward slightly. I like to do this because it's going to engage your glutes a little bit more. If you're perfectly upright this way, it's a lot more quad. I want to get my glutes and my quads firing together, so I like doing a little hinge forward, coming down into this split squat and back up. I'll show you from the side. Two sets of 20 on each leg. And with this exercise too, same thing, you want to be mindful of what the knee is doing. Is your knee coming in? If this hurts, keep it to a small range and just come up and down here. Okay, that is phase 1 of the exercises. Give it a try. Let me know how they feel.